Hi, my name is Rhonda. I'm a nurse with Nurse Family Partnership at Project Self-Sufficiency. I'm here today to talk to you about breastfeeding because August is the World Breastfeeding Month. The decision of how to feed your baby is a personal choice, and it's one of the most important of many decisions that you will make as a new mom. It takes a lot of patience and perseverance to breastfeed. So to be successful at it, you must have both the desire and the motivation to achieve this gift for yourself and for your baby. Gathering as much information as you can about the process of breastfeeding will help to empower you to achieve this important goal. Should you try to breastfeed and find that it is just not for you, that's okay too. Remember, any amount of breastfeeding is better than no breastfeeding at all. So I hope that you will decide to give it a try. If you choose not to breastfeed your baby, that's okay too, as what is most important is that you give your baby the nourishment that it needs to grow and develop. The American Academy of Pediatrics recommends that you exclusively feed your baby breast milk for the first 6 months of age. Then when your baby turns 6 months, you will start to introduce complementary foods, but will continue to breastfeed at least until the baby is 12 months of age. That's what they recommend. And then at 12 months, you will continue to breastfeed your baby for as long as you and your baby desire to do so. Research has shown that some of the benefits of breastfeeding your baby include that breast milk is a great source of nutrition for your baby. It has the appropriate amounts of protein, sugars, and fats needed for optimal nourishment and growth. As your baby grows, your breast milk will change to meet his needs. Breastfeeding increases your baby's immunity and the protection against disease as it contains antibodies, immune factors, and enzymes. Babies who are breastfed have a lower risk of developing asthma, respiratory infections, ear infections, meningitis, gastrointestinal diseases, obesity, type 1 diabetes, and sudden infant death syndrome. They have also found that breastfed babies tend to have a higher IQ. So you can see why it's so important to make the choice to breastfeed your baby, as long as you are able to. Benefits for the mom include a lower risk of breast cancer, ovarian cancer, type 2 diabetes, and high blood pressure. The return to your pre-pregnancy state occurs much faster when you have breastfed your baby. Convenience is also a factor that many moms like because you always have your milk supply along with you and you don't have to carry bottles and formula and those types of things. So it's the easiest for convenience. Although breastfeeding may be the most natural way to feed your baby, it doesn't always come naturally for your baby or for yourself. So it is best to take the time to learn and to educate yourself about the basics, such as how to position your baby, how to achieve a good latch, how often to feed your baby, and how to know if your baby is getting enough nourishment. When to start breastfeeding and how much should you breastfeed? It's very, very important that you start to breastfeed immediately after giving birth, or at least within the first hour, because that skin-to-skin contact that you'll have with your baby will send a signal to your brain that will then signal your breast to produce that important substance of milk. This will set the foundation for successful breastfeeding and milk production. When you first deliver your baby, you will produce a thick, yellowy substance that is a blend of protein, vitamins, and minerals. This is called colostrum and sometimes is referred to as liquid gold. You won't produce a large quantity of colostrum since the baby only needs a few teaspoons per feeding at first. By putting the baby on the breast frequently, about every 1 to 2 hours, the suckling stimulation will then help to produce transitional milk. Usually that occurs around the 3rd or 4th day after birth. It contains lower levels of immunoglobulins and proteins, but has more lactose, fat, and calories. Again, you may not produce large quantities, but that's okay because your baby's stomach is only about the size of a walnut, so it doesn't need a lot of milk. Then, when your baby's about 2 weeks postpartum, your mature milk will come in. It looks similar to skim milk. It's a thin white liquid with a bluish tinge. The mature milk is filled with fat and all the nutrients that your baby needs. Initially, you will place your baby on the breast frequently, about every 1 to 2 hours, but this will change as your baby gets older. It is best to nurse your baby on demand, so as a new mom, you will learn what your baby's hunger cues are. These cues vary from infant to infant, and some of the cues include the baby will nuzzle up to your breast, sucking on his hands or fists, opening his mouth really wide. He'll exhibit the rooting reflex, which is stimulated when you stroke the side of the baby's mouth, the side of the baby's face. The baby will turn towards that side and open his mouth wide. He might smack his lips together and make suckling noises, and he may even cry. So those are some of the cues that you will observe in your baby, and you'll learn when he's telling you that he's hungry. How to tell if your baby is getting enough milk? Well, first of all, you're going to pay very close attention to your baby and observe the signals that your baby's giving you. What's your baby's disposition? Is he content and happy after most feedings? That will let you know if the baby's getting enough. Also, you're going to count your baby's diapers. Yes, you're going to count your baby's diapers because you want your baby to wet between 6 to 12 diapers a day and have 3 to 4 yellow seedy stools. And that occurs about after the first 3 to 4 days of life. Just remember, whatever goes in must come out. So that is a good measurement of if your baby is getting enough to eat. Also, when you take your baby to your pediatrician, the pediatrician is going to weigh the baby and at all the well baby checkups, and this will tell you if your baby is growing appropriately. Your baby should gain between 4 to 7 ounces every week, starting around the 2nd week of life, and the baby should return to his birth weight by 10 days to 2 weeks of age. Another important thing that you're going to want to learn how to do is to hold your baby in different positions for breastfeeding. There are several different positions. You're going to have to try all different ones to see which one you're comfortable with and which one your baby is most comfortable with. And you may use one position today and a different one tomorrow, because as your baby grows and changes, the positions may change too. The first position is called the cradle hold, and that's exactly what the name implies. You hold your baby, cradling the head in the bend of or the crook of your arm at the elbow, and his body rests against your arm on the side that you're feeding from. You can use your opposite hand to position your breast so that the nipple points towards the roof of the baby's mouth. Then another variation of the cradle hold is the crossover or a cross cradle. That's similar to the cradle hold, but instead of the baby's head resting on the bend of your elbow, the baby's body rests there. You hold your baby's head with your hand that is opposite from the side that you are feeding on. You can support and position your breast with your free hand. And another popular hold is the football hold, and that's just the way you would hold a football, but a little more carefully with your baby. Okay, this position is very helpful if you have had a cesarean birth, because the baby's body won't be resting against your incision, so it's more comfortable. Then another common position is the side lying position. And again, you just lay down on your side and you position the baby next to you, facing you with his head in line with your nipple. You can use your free hand to support and position your breast into the baby's mouth. You can use pillows or small blankets or towels rolled up to help support the weight of your baby and to position the baby against your breast. Just remember, when it comes to positioning, it is most important that you're comfortable and your baby is in a relaxed position. I believe this is the most important factor in breastfeeding, and that is the secret of a good latch. To be effective, the baby needs to take more than the nipple into his mouth. His mouth needs to cover both your nipple and the areola. That's the dark discolored area on the nipple. He needs to be far enough onto the breast so that his lower jaw and tongue can massage the pools of milk and draw from the milk glands. The nipple should be positioned towards the roof of the baby's palate or the roof of the baby's mouth. If on correctly, less of the areola will appear visibly below the lower lip and above the upper lip. If the baby sucks only on the nipple, it will be very painful to you as his mom. And this is because the tongue and the jaw will just be rubbing against the nipple, and that will not produce any milk. It will just create soreness. Pain is really a sign that something is wrong. Nature would not have designed a system where it hurts to feed your baby. It is important that the baby's mouth covers a large circumference so that the pressure is dispersed. This will help to prevent sore nipples and facilitate the milk flow. Just think about it. If you take a little piece of your skin and you pinch, can you see that? That hurts. But if you spread out the pressure and grab a larger circumference, it doesn't hurt at all. So just remember that when you're putting your baby on your breast, you want the baby to cover a larger circumference area. To obtain a proper latch, you will hold your baby facing your breasts, tummy to tummy. The baby's body should be in a straight alignment and not turned. You can stimulate your baby to open his mouth by tickling his lip with your nipple or squeezing some milk onto his lips. That will get him started. You can stroke the cheek on nearest to you. This will cause the rooting reflex that I spoke about earlier. You just tickle the side of his cheek and he'll turn and he'll open his mouth wide. Once the baby opens his mouth, bring him towards your breast, supporting your breast until the baby has a firm grasp and suckle. The baby's chin and tip of his nose will be touching your breast. The baby's lips will be flared outwards, just like the way a fish opens his mouth wide. You should observe your baby as he suckles for a steady suck, swallow, breathe pattern. You will also be able to see a rhythmic motion in the baby's cheek, jaw, and ear as the baby swallows the milk. If it hurts or you don't feel the baby has a proper latch, you can place a clean finger at the corner of his mouth to release the suction and attempt a new latch. So the checklist for a good latch is tummy to tummy, neck slightly extended with his head tipped up, wide open mouth, lower jaw below the nipple, Your fingers supporting the breast should be parallel, lined up with the baby's lip. Chin pressed into the breast more than the nose. And that's how you get a proper latch. It is also very important that you always wash your hands before you pick up your baby. So before you're going to breastfeed, you're going to wash your hands with soap and water. That is the best prevention of the spread of infection. So always wash your hands thoroughly, using lots of friction as you wash before and after you breastfeed your baby. How long should a breastfeeding session last, or how long do you need to breastfeed? All babies are different and have different nutritional needs, so that will determine how long your baby will eat. In the beginning and during growth spurts, your baby needs to feed a little longer. It is important that at least one breast is well drained at each feeding. This is so that the baby will get the hind milk, which is richer in fats and calories. So you want to completely empty one breast before you go on to the second. Take your time, don't rush. Enjoy the process of breastfeeding. So you're going to allow your baby to completely empty breast number 1. Then you're going to move on to breast number 2 if your baby is awake and still hungry. Always at the next feeding, you're going to always start with the breast that you stopped with. And the reason for that is because usually the baby does not empty both breasts completely. So breast number 1's emptied, then you move on to breast number 2, and it's only partially empty. So that is why when you come to your next feeding, you're going to start with breast number 2 and then go back to breast number 1. Your baby should signal to you that he is done by letting go of your nipple. If the baby's suck pattern slows down to about 4 sucks per swallow, you can end the feeding again by placing a clean finger in the corner of his mouth to release the suction. It is common for babies to fall asleep at the breast. You have many resources available to you of knowledgeable people about breastfeeding. Your physician, pediatrician, obstetrician should be able to answer most of your breastfeeding questions, so feel free to give them a call. There are groups such as the Latch League, you can call them. Friends and family. There are breastfeeding groups of moms who have the experience and have experienced the things that you're going through. So reach out to them, and but use a reputable source if you're going onto the internet. Another great source is when you go in to have your baby, be sure to leave the hospital with the phone number to labor and delivery, because you're going to run into problems at 3 a.m. and you're not going to want to call that cranky doctor. So you call your labor and delivery nurse, because someone's always awake 24 hours a day and they're knowledgeable. So give them a call if you have a question. Also, you may have a lactation consultant that you can call. Many of the WIC offices have lactation consultants working from their offices, so that's another resource. And a great resource would be to call your nurse, family partnership nurse, with any questions that you have about breastfeeding. So I wish you all well. I hope you have a wonderful experience breastfeeding your baby.